Percussion of the lungs, Part 2. Percussion is done to check liver dullness, tidal percussion, cardiac dullness, and Traub space. Liver dullness. The upper border of liver dullness is defined by 5th intercostal space in the midclavicular line, 7th intercostal space in the midaxillary line, 9th intercostal space in the scapular line. This is known as the 5-7-9 rule. Tidal percussion. This is done to differentiate upward enlargement of the liver or subdiaphragmatic abscess from right-sided parenchymal or pleural disorders. Percuss down the midclavicular line until the normal resonance of the lungs becomes dull. This usually occurs at the 5th intercostal space. Then simply have the patient breath in and out deeply while continuing to percuss. If, on deep inspiration, the previous dull note becomes resonant, the dullness was due to the liver. Persistent dullness, on deep inspiration, may be due to diaphragmatic paralysis, right-sided parenchymal or pleural pathologies, such as pleural effusion, tumors, etc. Cardiac dullness. Outline the area of absolute cardiac dullness. It is a fist-sized area, just to the left of the sternum. The absence of cardiac dullness is suggestive of emphysema. Traub space is a crescent-shaped space, encompassed by the lower edge of the left lung, the anterior border of the spleen, the left costal margin, and the inferior margin of the left lobe of the liver. Thus, its surface markings are superiorly left 6th rib, inferiorly left costal margin, laterally anterior axillary line. Usually, Traub space is tympanitic due to the presence of the gastric bubble. Traub space is obliterated in the following conditions: left pleural effusion, massive splenomegaly, enlarged left lobe of liver, full stomach, fungal growth, and massive pericardial effusion. Traub space is shifted upwards in left diaphragmatic paralysis, left lower lobe collapse, and fibrosis of the left lung. Special features of clinical importance. Percussion tenderness is present in empyema and inflammation of the parietal pleura. Straight line dullness is seen in hydropneumothorax. Shifting dullness. This is done to demonstrate the shift of fluid in pleural effusion and hydropneumothorax. In hydropneumothorax, shifting occurs immediately, whereas it is very slow in pleural effusion. The immediate shift of fluid can be demonstrated by the dull area percussed in the axilla and the sitting posture becoming resonant on lying down on the healthy side. S-shaped curve of Ellis. In moderate-sized pleural effusion, the uppermost level of dullness is highest in the axilla and lowest in the spine, and tends to assume the shape of the letter S. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.